Thank you so much, Sarah, for joining me today to talk about your incredible book, which you can see in the background of Sarah's lovely bookshelf. So I really appreciate you being here and talking about such an important subject that affects so many people in this world.
Thank you. Thank you for having me.
Amazing. So, without further ado, I'm going to just quickly do a brief introduction and then just go straight into it. So, Sarah Graham is an award winning freelance health journalist and founder of the Hysterical Women blog, specialising in health, gender, and feminism. She has written extensively on these subjects for the newspaper, Refinery 29, The Telegraph, Grazia, Guardian, BMJ, and many others. She was a finalist of the 2021 Medical Journalists Association Awards. We're talking about her book, Rebel Bodies, A Guide to the Gender Health Gap Revolution. So, of course, I have to ask, what does the personal is political mean to you in terms of health?
I think it's everything really. It's kind of the whole sort of thesis statement of the book. Um, I think one of the things that I was really conscious of, kind of as I was putting my book proposal together in the midst of the COVID pandemic, was that, you know, health is such a kind of personal issue, but it's also a public issue. Public health has been such a kind of huge thing in the last few years, and it's not just personal, but it is political. The political choices that our governments make have such a big bearing on the health of the people. Um, and so, yeah, I really wanted to explore all of the kind of very interconnected ways that health is both personal and public and political, that each of us has an impact on each other's health, that
Mhm.
our political choices have an impact on the health services that we receive, and also that the our political leaders have the power to determine the services that we have access to.
Yeah, it's scary how much power they have, and yet still there is still nothing happening for us. And so, what do you think is the danger of hysteria, like having been a diagnostic reasoning behind women's health for such a long time?
Yeah, absolutely. I mean, it's one of those things where when you look back on the history of medicine, this idea of hysteria has been around for literally thousands of years. And that so much of the way that we think about women's health, women's bodies, women's hormones is still tied up in this idea that we're kind of almost slaves to our bodies, to our wombs, to our hormonal fluctuations, and that there is this idea within medicine where the male body is very much the default. That is the norm. That is still, the body that doctors at medical school are taught to treat. Um, and
Mm.
that anything that kind of deviates from that is other, is alien, is kind of almost inherently broken, and so I think that has a massive bearing still on the way that the medical profession treats women, not necessarily in a conscious way anymore, although I think,
Mm.
sometimes it is. But I think a lot of the time it is very much an unconscious bias that we see it a lot in this idea that women are more emotional, that we're more irrational, that, we can't be trusted to kind of
Mm.
accurately report what's going on with ourselves, that we're more likely to exaggerate. And so that has a huge impact on whether women are trusted, whether they're believed, whether their symptoms are taken seriously.
Yeah, no, absolutely. So, would you say that is the reason why women are dismissed a lot of the time and also, in a way, gaslit when it comes to healthcare?
Yeah, I think it's a big part of it, certainly. I think, the way that I talk about it in the book is, there are kind of multiple different elements to it. So there is obviously that huge cultural and social element of, bias and stereotypes, and that isn't just sexist stereotypes, but racism and ableism and
Mm.
ageism and all these different things that are kind of wrapped up within that kind of package of misogyny.
Mm.
Um, so that I think it's a huge part of it. I think a lot of it, particularly in an NHS that is under enormous pressure, and we're kind of
Mm.
seeing that the huge crisis that the NHS is facing at the moment, doctors have to almost rely on these kind of, one of the doctors I interviewed described it as mental shortcuts. So you rely on stereotypes because you have to make judgments and diagnoses really quickly. You haven't got time to sit and think about it and figure it out and tease out all of the different complexities of the patient's symptoms in front of you.
Mm.
So I think that capacity issue, that time, the workforce shortages all kind of play into it. And then, of course, you've also got gaps in knowledge where we perhaps don't have as much research around the issues that primarily affect women. We don't, doctors perhaps don't have as much medical training on issues like
Mm.
menopause, on menstrual health. So it all kind of combines together to create a world where, healthcare professionals have less knowledge and understanding, have these kind of really deeply ingrained sexist ideas and biases that affect whether or not they believe you. And actually, if you don't have the knowledge to be able to make a quick, accurate diagnosis, sometimes it is, almost kind of easier to
Mm.
blame the patient than to say, actually, I don't know. Like, as a doctor, I think that must be, as any kind of professional, none of us like to say, I don't know. That's really
Mm.
hard. And I think it's particularly hard for doctors because we have this kind of mindset of doctor knows best.
Yeah, definitely. And actually, do you think that's the reasoning behind why people still, or doctors rely so heavily still on BMI, even though it's so unreliable? And especially, as you mentioned, for people of color, for people who are disabled, and it just doesn't sort of fit in with that structure. So, why do we still rely on things like BMI?
Yeah, absolutely. I mean, BMI is a really interesting example of something where doctors are often very quick to almost kind of scapegoat people's weight.
Mm.
And we know that within the NHS, BMI is sometimes used almost as kind of a way of meeting targets, or, denying treatments to people on the basis of their weight, saving money, and that's really problematic because it's almost kind of become socially acceptable for medical professionals to say, well, your symptoms are probably just because you're overweight. You need to lose weight
Mm.
before I can do anything. And, for the majority of people, actually, their weight will have nothing to do with their symptoms, and losing weight is not going to help them. But it's kind of an easy way to fob people off and say, do this first, and then we'll look more seriously at it.
Yeah, and it's scary because obviously it's not just like weight issues, but also like chronic pain, which obviously you
Mhm.
mentioned in the book is affects women quite vastly. So, you know, does that make that a disability a feminist issue then?
Yeah, absolutely. I think disability is one of the really kind of key central themes of the book. It's something that I feel sort of runs through a lot of the book, and it's very much a feminist issue. Disability, chronic illness, chronic pain disproportionately affect women.
Mm.
And, even where men are also affected by certain conditions, they get better treatment. Their pain is better managed than
Mm.
women's pain. And that's not just my opinion. There's research showing
Mm.
this, as well as the kind of anecdotal stories that are in the book. So yeah, I think disability is huge. I think, and again, coming back to the COVID pandemic, the way that disabled people have been treated really highlights, I think, disabled people are almost kind of an example of the way that the government would treat the rest of us if they thought they could get away with it.
Mm.
They are the bottom of the bottom of the ladder. They're the people that the government thinks they can get away with it, and the
Yeah.
majority of people don't care enough to stand up and say, actually, that's not acceptable, because they are so often invisible in
Mhm.
society. So yeah, I think for me, a lot of us are very kind of complacent about a disability. We think that is
Mm.
something that's never going to affect me, so I don't need to worry about it. And actually, all it would take, long COVID has demonstrated, all it takes is an infection, an accident.
Mm.
None of us know what's going to happen tomorrow. It could happen to absolutely any of us. And I think we all need to be more mindful of the way that those with disabilities are treated within the healthcare profession and society more broadly.
Oh gosh, yeah, I can totally attest to that. I am a disabled woman of color. So I use a wheelchair, so I can totally attest to everything that you just said there. And and I think not just obviously people with disabilities, but people who are trans women, non-binary people, men, and obviously those with intersectional identities. Why do you think they do have just more trouble and difficulties accessing healthcare?
I mean, I think it's the same as a lot of the issues that we see across society with these kind of different groups, is that, if you're a woman who is also a person of color, or you're a woman who is also disabled, you have these kind of multiple disadvantages. And it's almost as if the more of those you have, the the more stereotypes and biases that healthcare professionals and other people within society have about you. So it becomes very easy for people to put you into a box rather than to treat
Mm.
you as an individual. And you see that a lot. I talk about some of the racist stereotypes, for example, about black women giving birth and being seen as aggressive, and
Mm.
when actually they're just asserting themselves. And so I think, a lot of these things come out where you have sexist stereotypes combined with racist
Yeah.
stereotypes or ableist stereotypes, and it just really compounds the issue for these people.
Yeah, no, absolutely. And I've read like just even a few like encounters. Like I think Candice Brathwaite wrote about it in her book, isn't it? Not Your Baby Mama,
Yes.
where she was just basically, she had sepsis, and they just assumed that she was too strong enough to deal with the pain, which is
Yeah.
horrific,
Yeah.
obviously. So
Absolutely awful.
it's awful. And so what do you think the solution is for more funding for the NHS for more empathetic care? Like how do we get that like funding for the NHS?
And I think it's such a complex problem, and the solutions are similarly really complex. I think, like you say, we need the government to step up with funding. We need them to step up with a workforce plan that not only attracts more people to work in the NHS, but that ensures they have good enough working
Mm,
conditions, that they can treat patients safely, compassionately,
yeah.
that they have time to care, and
Yeah.
also that they want to stay. I think a huge part of the problem the NHS is facing at the moment is around staff retention, because
Oh
it
god.
is just so bleak working in that environment. And so that was one of the things I really wanted to get across with the book was, yes, the focus is on patient experiences and how awful it is sometimes to be a patient who is a woman or a trans person or non-binary person, but also actually that it's not just patients that are struggling in this system, that for
Mm,
healthcare professionals there are real challenges. So I think, yeah, the funding, the resources, the workforce is a huge thing, and we need the government to lift its, to give us that. We need, that is something that we cannot do as patients. We need that to come from the top. um I think, equally things like training, medical education, but also,
mm,
I think engagement with, between healthcare professionals and patients. So
yeah.
social media actually is a really great example of this, where you have doctors on TikTok doing
Yeah.
public information and public awareness videos, but also, where you have patient communities on Instagram, on TikTok, whatever, talking about their experiences
Mm,
in a space that healthcare professionals can also engage with. So I think having more of a kind of open dialogue is really, really important. And again, this is why I wanted to get both sides in the book, because I think we need to have empathy on both sides. We need to understand
yeah.
where each other is coming from. Um, and for healthcare professionals to really be able to kind of reflect and take stock on their own practice, think about the way that they are treating people, and that, you know, that is really hard when you just do not have time, when you're so overworked
Mm,
and
yeah.
so pressurized. But I think if you can just be a bit more conscious of it, if you can just kind of analyze the way that you're treating people, and try to make sort of conscious steps to change your practice, then that's really important as well.
Yeah, no, absolutely. It's just the whole system needs a lot of support, and it's all sort of crumbling like Jenga at the moment, isn't it? Um,
Yeah,
uh,
absolutely.
but actually, before we get on to the last question, I was really curious because obviously I saw your blog, the Hysterical Women blog, which I thought was brilliant. Are you still running that?
It's taken a bit of a back seat. So obviously, I at the same time as writing the book, I was pregnant,
Yeah,
and then had the baby, and then published the book. And so the blog, which, you know, at the end of the day doesn't make me any money, has definitely kind of taken a bit of a backseat. I'm not entirely sure what the kind of future of it is. At the moment, you know, I've been so kind of focused on promoting the book,
of
talking about the
course.
book, events and interviews and all of this kind of thing, that yeah, I haven't really got it kind of back up and running since I went on maternity leave. But yeah, who knows? I mean, I'm still open to it. If people are still keen to contribute, I'd love to hear from them. But yeah, at the moment, it's just a little bit on pause while I figure out everything else, and like the juggle of being a new mum and a freelancer and all the
Oh
rest of it.
God. Yeah, it's a lot to deal with and totally understandable that you just want to just put something on the side for a while,
Yeah,
especially, yeah, absolutely. Yeah, absolutely. And, I only just recently, even recently, heard someone being referred to as a geriatric mother for being 35, and I was like, "Oh God, what? That is
awful.
terrible."
Yeah,
And so, it does bother me that we're still in this situation, still having this conversation. But I really appreciate you writing this book, Sarah, because obviously the more we highlight this issue, I'm hoping that the more eyeballs will be on it and they can start reconsidering this kind of language and just the associations.
thank you. Yeah, I hope so too. Yeah, that's you know, that's really what I want to achieve with the book. Is I wanted something very comprehensive, very nuanced, that looked at these issues in a really kind of holistic way, from all the possible angles and perspectives, and I really hope it does reach the people who have the power to make a difference. But equally, you know, I hope it reaches the patients who are feeling
Mm.
isolated and alone, and like there is nothing that they can do, because yeah, people shouldn't feel powerless in this system, but I know so often that they do.
Yeah, absolutely. And on that happy note, thank you so much, Sarah, for joining me today. I really appreciate your incredible insight and your all the incredible, just all the incredible information you put in the book as well. As a patient myself, I could totally relate to what you're saying, and it was just really wonderful to be able to read about it. So thank you so much.
Thank you, and thank you for having me. It's been really lovely.